Good evening. Hello. We'll start in a minute. We'll start 5. Today we'll be discussing about the mini mental status examination developed by MF Falstein, and we'll see how quick and effectively it can gauge your cognitive abilities. After the live is over, we will put a link for the certificates. So do check it in. Even after the live is over, it will be uploaded on YouTube, and you can always check in there and fill up the form in order to receive your certificate. There'll be one short question attached to it. So you just need to fill that in and submit. Okay. So we'll quickly get started. It's 5 and welcome everyone. My name is Dr. Ria Das, and on behalf of EMOJAR, I'll be discussing about the mini mental status examination, and we'll look into the aspects of this particular test. So, now to give you a brief background about the test, it was first considered or developed in 1975 by M. L. Falstein. Okay, he started understanding that for a quick assessment, you need certain parameters in order to gauge a person's cognitive abilities. Okay, good evening. So we'll be doing this quick and effective method, which hardly takes maybe 10 minutes to conduct and very easy to score, easy for guidelines to be maintained. That's why it's very effective as well. But you have to take it into consideration that this is not for the sole purpose of diagnosis, but just for an initial diagnosis, you want to check a person's cognitive ability in adults. Or if you have cases that there might be some confusion about brain injury or some setback in life, some kind of trauma, it can gauge whether the person is suffering through any cognitive distortions. Okay, welcome, welcome. We have more people joining in. So, if you can introduce yourself quickly in the chat, maybe we can go ahead with it. Like, what do you do? What's your profession? I'm a counseling psychologist and I've been into this field for the last 14 years. And I chiefly deal with children and adolescents. But apart from that, I also take up art therapy sessions. Today, it's going to be a little different. There'll be more of teaching. I hope my voice is audible because there's a lot of background noise going on somewhere. Okay, good evening. I can see a lot of familiar names, so welcome once more. And today we'll start off with the MMSE, that is the mini mental status examination. Okay, it's nice to see clinical psychologist, school psychologist. Welcome, student. That's nice. Okay, now to give you an overview of what actually MMSE comprises of, in a very short and precise way, I'm going to tell you. It has a total of 30 questions or parameters to be checked, and each parameter has different scoring systems. I'll be teaching you soon how to score the different parameters. You'll also get a PDF or a template to work on, and the range of scores which you need to, uh, you know, go back and refer to. Hello, hello, good evening. Okay, now this particular test is used to quickly gauge the cognitive impairment in a person. So, in order to find out quickly whether the person is having some cognitive distortions or impairment in particular, we tend to administer this test as the first step. If you find some below average scores, you need to refer the person further for further testing. In fact, it is different from mental status examination, which is a wide range of aspects put into one part, but this is totally different. It hardly takes 10 minutes to conduct. Okay, now moving on, it generally gauges problems with thinking, communication, understanding, and memory. Okay, so if your doctor or your clinical psychologist or psychologist feel or suspect that there may be some kind of confusion or some kind of head injury which may lead to certain cognitive impairments, this test can be conducted immediately. Okay, so the different parts of this particular test I'm going to tell you, and maybe you can quickly write it down. The first part is the short term memory. There are questions which understand what's the level of your short term memory, your attention span. What is your attention span, whether it's wavering, whether it's intact. Next is concentration level, language and communication skills, ability to plan and execute, and ability to understand instructions, because that becomes very important. Okay, and what does it involve? It involves a series of tests which needs to be conducted by an expert and can be easily calculated. So you need to be very, very careful what you are scoring. You need to be very observant as the person is giving you certain responses as well. Okay. The different items in the test consist of memorizing, then repeating whatever you said, maybe going backwards and telling you certain things, okay, and maybe narrating certain things as well. Thank you so much. Thank you for your kind words, please. That keeps us motivated. So writing short sentences can be, or telling certain short sentences can be you sitting on a sofa, or you are eating and having an ice cream. So these are short sentences which maybe a person with cognitive impairment will find difficulty in, uh, maybe narrating it also. So, based on these chief highlight areas, we'll be looking into each of these questions or the subsections. Okay, so don't worry, you can write your notes, but again, we'll try to attach a PDF or send the PDF when you are applying for your certificates. We'll send it across with that. Okay, so repeating it once more. The cognitive impairment part can involve problems with thinking, reasoning, communication, understanding, as well as memory and planning. So, all these areas are looked into by the MMSE test. Okay. So, any questions, you can just quickly put it down, and then I'll move forward. Scoring is pretty simple. There's a guideline, so you just need to follow that. You tend to score what the person reproduces, and based on that, you may take out the total and you put them in the range. It is that simple, and it's very quick. You want to understand whether there is some cognitive impairment. This is the first test you should go for, because it gives you a brief holistic view as to what the person is going through. Okay, and based on these results, you can work on it, or you can further recommend the person. But this is not the ultimate test. It's again a word of caution. It's a quick test, quick way of knowing what your patient is going through, what's the cognitive condition. And then if you feel that yes, it needs further intervention, you go into more details. The sub items you can quickly again write down: short term and long term memory, your working memory, basically your attention span, concentration level, ability to plan, language and communication skills. Then the other parts of remembering and retention, all these areas are looked into. Now if you can see, I have a printout. This is a typical form, okay, of MSc. This one is a typical form. You can have a series, because if you have a series of scoring, then you can monitor how the person is either improving or deteriorating. So this test can be very handy. Like if you want to see the progress or whether the person is deteriorating with the passing days. In case of dementia, it can be a probable indicator of dementia, and you can keep a track also. If it is so, you can take quick actions. So this is a one-page typical form of MSE. Okay, we'll be doing one items first. So the first section, maybe you all can write in your notes. Maximum score for the first section is 5. It's as simple as that. And the questions which are included in the first sections is, what is the year? Basic questions, what is the year, the season, the date, the day, the month. So this is also a kind of short-term memory and long-term memory. This is the memory system which we are looking into. So what is the year, the season, the date, the day, the month? So five of these areas are marked 1 1 each. If they get all correct, you give a maximum score of 5. Okay, say for instance I couldn't say the date today. Okay, cognitive impairment also deals with the working memory, short term memory, all these gets muddled up. So for that person, these simple things can also become very challenging. So what you do is, maybe I got the date wrong, so I give a score of 4, others were correct. Year, season, date, day, month, 5 of them, and you need to score a 5 if they get all correct. In case of an error, it's a -1. Okay. Next portion is, where are we now? That means the presence of mind, the awareness around the environment, the connection with the environment. Okay, where are we now? The state, the country, the town, the city, town or city, the hospital or the place where they are in right now, and the floor. So similar questions related to the locality of the place will be under this section, that is section number 2. This again comprises of 5 sections: 1, 2, 3, 4, 5. So 5 questions you're going to ask about what's their presence around them: state, country, town, or where are we now, which floor are we sitting. All these are the connection with their environment. Okay, how much aware or how much connected they are to their environment. So you give a maximum score of 5 here as well. It's not subjective scoring, it is totally objective scoring, because they are giving responses, and then you're scoring on based on the right or the correct responses. So it is more of a rigid scoring system. It is not a subjective scoring system, unlike DAP or TAT, where we have a lot of subjectivity crawling in. But this one is very, very objective. And it hardly takes 5 to 10 minutes, in fact, to conduct the entire test. Okay. Yes, orientation with the environment of the patient. Correct. Okay, so next one, number 3 has a maximum score of 3. The third section, maximum score of 3. The examiner has to name 3 objects, anything which is unrelated and daily use, very clearly and slowly, so that the person can listen to it and then reproduce it. Okay, so unless and until the person is able to reproduce these 3 words, it can be any random unrelated words. Okay, you have to read it out very slowly. Say for example, I tell you, pillow, money plant, book. Okay, so these are the 3 words which I told you, and the person needs to recollect them in order, and you have to keep on repeating it unless the person remembers it. Okay, if you find that the person is not able to repeat or not able to tell you, you have to score a 0, or whichever word the person missed out, it will be a -1. So 3 words, one point for each to reproduce correctly in the most clearest way. Okay. So this done, but you have to pause over here and make the person learn it up if the person is unable to learn it till that point achieves. Like the person needs to memorize the entire 3 words. It might seem that okay, only simple 3 words and the person can't remember, but yes, in cognitive degeneration or any kind of trauma to the cognition, it can cause certain impairments, it can cause certain hindrances in learning. Short term memory is also affected where there is some kind of damage. Okay, so this you will repeat until the patient learns it completely, and then only move on to the fourth section, which again comprises of 5 points. Now, for the Fourth section, it is more of the sums. You have to instruct the person to count backwards. Like, for instance, I would like you to count backward from 100 by sevens. So it would be 93, 86, 79, and so on. Okay, so the person needs to count backward by 7. If the person is able to count backwards, then you have to give one point to each of the five numbers the person could tell you. Okay. um Alternatively, you can also have words spelled backwards. It can be a five-letter word which can be spelled backwards. Okay, say for example, world, it can be as DLROW. So it's kind of a comprehension and how you can utilize your working memory and how fast you can process information which is not common to you. Okay, so this area looks into it and you need to have 5 points in it. If they miss out on one, it's a -1 for them, right? The next section, the fifth one. Now this comes over here, the long-term memory function, where you have to tell them that now I have given you three words to learn. You have to reproduce and tell me whether you remember it or not. So they are going to tell you those three words which you made them learn just a few minutes back. Okay, if they're able to successfully tell you or reproduce these three words, you give them one point each for each of the three words. This step is pretty simple. If they cannot, you have to mark them a -1. Okay. Next portion is to show the patient two simple objects such as a wristwatch or a pencil, or it can be any household item or whatever is lying around, and ask the patient to name them. You have to just pick up one object and ask, which one is this? What is it called? Okay, if they are able to reproduce, you give them 2 points, one each, right? So I hope y'all are writing down. Okay. Next one is just for 1 point. Repeat the phrase no ifs, ands, or buts. This is the phrase which they need to repeat after the therapist has told them, after the examiner has told them. The person, the client needs to reproduce that and tell. Okay. So repeat the phrase. You just tell them, repeat this phrase. No ifs, ands, or buts. Okay. So once they repeat it, you're going to mark them with 1 point. If they fumble or they cannot or they can't remember, it will be a 0. Okay. Next one will be a fine motor task. It will be a performance task. So you have to ask the person to have a piece of paper, a blank sheet of paper, and you have to tell the patient, take the paper in your right hand, fold it into half, and put it on the floor. Okay, this is the instruction which you need to give. Take the paper in your right hand, fold it into half, and put it on the floor, and you hand over a blank piece of paper to the patient to complete this task. If the patient is able to complete all three steps successfully, they will get 3. If they miss out or do one step wrong, they are going to be marked as -1 for each of these tasks missed out. Okay. Okay, so moving on to the next last three portions. um, you will have a sheet of paper where you have to tell or instruct the client to please read this and do what it says. So you'll have a card or a piece of paper. On it you have to have the writing, close your eyes. Okay, it has to be written on that piece of paper, and then you give it to the person and the person does what he's asked. Okay, so it's following the instructions and following and understanding what is being asked from them. It's about the awareness as well. Okay, it's about listening skills, awareness. Both these tasks generally gauge how much they are able to remember and reproduce and understand instructions, as well as follow them properly, step by step. This will be for 1 point. If they're able to successfully complete it, they'll just get 1 point. The second last one is make up and write a sentence about anything. So it can be one simple sentence which the person needs to um, tell you, which has a condition. The condition is it has to be have a noun and a verb. Okay, so this is the instruction. This generally gauges the language or communication skills. The last one is a picture to be copied. This one may look very small, but this is the picture. Okay. This they will need to exactly copy the way it is. You just have to instruct them to please copy this picture. That's all. You need to have a blank piece of paper on which you're going to ask them to draw the symbol below. And you have to ensure that all the 10 angles must be present and it should be intersecting each other exactly the way it is. There should be an intersection as well as there should be all 10 angles present. Okay. So this one was the last one. And even if they get one angle wrong or if they are not overlapping or intersecting, you will have to mark them a zero. Fine. So this is what how quickly we did it. It may have taken us approximately 10 minutes and because I've been explaining things to you. But once you start conducting this, it might just approximately take 5 to 7 minutes to be completed. And a few words of caution, which I've noted down here as well. You have to make the patient feel comfortable because this is not a test which they need to pass or fail, and they need not prepare for the test, or this is not an intelligence test at all. Okay, and in isolation, it will not diagnose you with any disease such as dementia. Okay, so this orientation is required. Can you explain section 7 with example? Repeat the phrase no ifs and buts. That one. You just have to repeat that. You have to tell them no ifs, ands, and buts. Okay, that is the thing which they need to reproduce. In fact. Okay, so let's discuss the scoring now quickly. The scoring is simple. You just need to add up this column. You can have more columns here. You're not going to show this to the patient. You're going to keep it with you. This will be for your reference. You're just going to mark them. You can have 2 3 more columns added so that when you are taking the test again, if you feel the necessity of the test to be conducted again quickly, you can just add on to the score rather than having a separate sheet. And also make it a point that you put the date here because that will be useful. Okay. So after you get your scores written over here, you just need to total it up. Here's a total sign, and it should be either maximum of 30 and minimum of 0, of course. Um, it should not exceed 30. Otherwise, it's an indication, it's an error. Marks for question 1 and 2 are 5 and 5. They have 5 questions each, and you need to complete those 5 pointers. I'll be sending you this PDF. Okay, once you enroll for the certificate, once we mail you the certificates, your certificates, you are going to get the PDF for printing and referring to it. But it's good if you make your own notes. That's the way we generally learn quicker. Okay. Um, so now coming to the interpretation of MMSE, the single cutoff is if you have scores of less than 24. Okay, more than 24, 25 to 30 is the normal range. Less than 24 is an abnormal range indicating some kind of cognitive impairment. Now, if we go by the range section, it's lesser than 21, increased odds of dementia, may have a probability of dementia, but that needs to be clinically proven after your initial observation or certain initial diagnosis. Okay, and more than 25, it would be decreased odds of dementia. Now, going by the education level, this is one of the drawbacks of the test. You need to be at least have elementary education. Uneducated people will find it difficult to give certain responses. So, this is one of the chief drawbacks for this particular test. Okay, so range, again I'm telling you, single cutoff less than 24, that means we're looking at a total holistic way. If it is less than 24, it's considered to be abnormal. That means some kind of cognitive impairment is present in the person. This is for adults, and you need to refer to the adult age group, 18 years and above. A score of 24, a total of 24 or less than that in fact is considered to be abnormal. If we go by the dementia criteria, less than 21 is considered to have increased odds of dementia. Education wise, 21 is abnormal for the eighth grade education. If it's an eighth grader, um, even below that, 21 indicates that your cognitive impairment status is below abnormal for an eighth grade education. Anything less than 23, abnormal for high school education, and anything less than 24, abnormal for college education. Now, going by the severity of these symptoms, 24 to 30 is no cognitive impairment, 18 to 23 is mild cognitive impairment, and 0 to 17 is severe cognitive impairment. So accordingly, you can have this further classification based on these single cutoff and severity. 24 to 30, no cognitive impairment. 18 to 23 is mild cognitive impairment, and 0 to 17 is severe cognitive impairment. Okay, so we see the mild category may require certain kind of supervisions or hand holding and some kind of assistance and training. But the moderate to severe one needs 24/7, caretaking basically, and assistant and supervision. And that generally affects their day to day living, how they're adjusting with their environment. Their memory will be poor, their speech will be poor. So these are the few characteristics which generally the score may depict, and what all intervention, whatever vocational strategies you want to implement can be successfully built around, in fact, this. Hi, Shoini. It's good to see you. Okay, so I guess I've covered this quickly. It's, as you can see, it's a very pretty, quick test. So you can conduct it with someone whom you feel that yes, you need to work on, and you need to further intervene and understand what's the cognitive status of the person. You can quickly and safely do this. But again, a word of caution: do not only bank on this result. You need to clinically prove, if you find that yes, there may be a chance of certain cognitive distortions, but that needs to be coupled up with proper testing as well. Time limit for each question, no, but we generally keep a very short time, because this needs to be, in the constant flow. You cannot have the person giving you answers for a very long period of time. It's more like an impromptu question. It's a day to day based questions. Okay, there's no rigid time frame, but as per your understanding, however little time is required for the task to be completed, we generally give that much of time. Okay, so any other question? I think we are done with today. So you just need to wait for the link to show up in the description of this video, and then maybe you can submit your details so that we can send in your certificates. There will be a few questions outlined. You can answer them, and only after you answer, we'll be sending you the certificate along with the complete PDF of MMSE. See, MSE is a very elaborate one. In case you need to further delve deeper, understand which all areas needs, concern areas are there. Because by this, you'll be able to know which areas are lagging behind. So based on that, MSE will give you a much more detailed report of what the person is going through, what the cognitive status of the person is. Okay, a much more detailed report. So this is a quick check basically. You're just checking in order to see everything is fine or not in case of any doubts. Okay, and that this is not even a very threatening kind of an information where the person feels zapped out of energy going through all the questions and all for hours on end. This very quickly gives you kind of a mini report. That's why it's called mini mental status examination. Okay, then it was lovely talking to you all, and thank you for being here. Uh, we'll be uploading the link soon, so do come back and check end of the day for the link for your assignment and your certificate. Thank you so much for joining in. I'll come up with more such quick checks which can be useful, so stay tuned, and don't forget to subscribe to our interested and even other things. Okay. This is for adults, ma'am, not for children. Children, I'll come up with something else. I'll soon update. Thank you, everyone. Have a nice day. Bye bye.